of the biggest complaints that I hear from patients across the board, from women who have been adversely affected by the healthcare system, is the fact that they don't feel heard. And that's been an issue from the start.
Taska Moore is a doctor who specializes in obstetrician and gynecology, but she knows sometimes patients struggle with their physician listening to them. But her advice to healthcare providers is to take the time to understand what that mother may be going through.
We have set up a healthcare system that will fail. Just by those basic groundwork, the structure of our healthcare system, we ought to prioritize the ability to be able to talk to a mom, to be able to hear what's going on with her. And for my clinicians, always ask the why.
And when it comes to women of color, statistics show they are more likely to die when giving birth. It was the high maternal mortality rate that motivated Moore to start an organization with other doctors called Healthy Bump.
Definitely a terrifying thought, being pregnant and black and thinking, I need to be able to and ready to advocate for myself.
More disparaging for women of color because our journey is a little bit different, our experiences are different, and we wanted to have that discussion from our perspective. Not only are we clinicians, but we're also patients as well. So we do have that dual experience of knowing what the healthcare system is like for women of color, and also have the professionalism to discuss the topics that are critical to us.
Healthy Bump starts with making sure women are educated when it comes to their birth.
Part of the way we address that is by informing women, because one of the things that we've noticed is the more a woman is empowered, the more she's aware of her own health and the things that she needs to be aware of, to watch for, the more empowered she is and the more control she has over her health care. Know that you can search for your healthcare provider. You don't have to choose just who's in your neighborhood just because. You can address it with your insurance company and ask them for referrals to another provider if you don't feel comfortable.
Moore adds, once you've decided on your provider, continuing a healthy lifestyle can prevent negative outcomes when you are pregnant if you start before pregnancy.
I think that's one of the aspects in which we can improve outcomes, is we know that a healthy lifestyle, healthy diet, one, improves fertility, and we know that there's fertility issues in the U.S. So if we improve the lifestyle of women, optimize their health, so women who have chronic diseases such as diabetes, such as hypertension, are well controlled, then their outcomes are going to be better.
But Moore says it doesn't stop there. Even after pregnancy, she says it's important for patients and providers to keep their relationship.
Making sure that there's a continuity of care. This is something that ACOG is working hard to do, is to make sure it's not just, oh, you're done, you're delivered, that's the end of our story. No, that's the continuum of our story, making sure that after the delivery, that patients have a continuity health care, because her next pregnancy is also important.
She says these steps are important for learning from mistakes that have occurred in the past and taking steps towards a better future.
So when she just experienced preeclampsia, making sure that moms know now it's time to really continue taking good care of yourself, because preeclampsia increases the risk of long-term hypertension, of heart disease, and things that we can't prevent.
Moore says she believes the United States spends more time on the commercialization of Mother's Day, but there's not enough time going into taking care of moms.
Prioritize moms, prioritize the celebration of birth, bring that back. Right now, birth is just a process to us, but that's not what birth is. Birth is a miracle that ought to be celebrated. And if we change how we treat women as a whole in this country, then the symptom of that, or the outcome of that, will be an improvement in how we care for our moms.
But she adds it will take everyone coming together to make a difference for mothers.
This is going to take a team effort. The healthcare system is such a myriad of different aspects of it that there is no one solution to this maternal health crisis. This is all hands on deck.
For more testimonials and lessons from women of color healthcare providers about pregnancy planning and journeys, you can visit the Healthy Bump Club Instagram or YouTube page.